Hey guys, Dr. Segel here. So what if I told you that I'm going to do a quick office procedure? I'm going to make an incision super small, like that, 5 millimeters. You're going to be sterile forever, but it's going to cause black and blue swelling down there, sometimes for weeks, sometimes even golf ball size swelling, but you're going to be okay. Okay, let's talk about what to expect, how much agony you're going to be in or not be in after a vasectomy. Hey guys, so the question is, what is it going to look like down there and how much agony am I going to be in after the vasectomy? And so let's talk about that. And then at the end, we'll talk about what I think is probably the number one tip to make you have a smooth course and decrease your pain after the vasectomy. So make sure you stay tuned to the end to figure out that tip. So when we do a vasectomy, we're making usually one incision in the scrotum. We talked about this in other videos, and we are able to transect the vas deferens usually through that tiny incision in the scrotum. One of the things that we do to try to help with your acute pain after a vasectomy, a ton of urologists do this, I certainly do it, is to give you a nerve block. So this is the vas deferens. There's nerves that run on either side of the vas deferens, all right? So before we grab it, so we got to make a little incision, then we got to grab it. Either before or right after we grab it, we'll usually inject some numbing medication along the vas deferens, because what this does is it numbs the nerves, and these nerves go all the way up into the abdomen. That's why sometimes during a vasectomy, guys kind of feel a little bit like they got kicked down there. Anyway, we give that nerve block. Now, the implication for that nerve block is oftentimes you won't have discomfort for a number of hours after the vasectomy, which is nice because it gets you through that acute period, lets you kind of get home, get set up, get in a position where you can relax for the next day or two. So the nerve block oftentimes is a nice little ticket, a nice little segue to get you into a position where you're more comfortable at the vasectomy when you can kind of control your home parameters, I usually like to say. One thing I'll tell guys is usually that day, it's not so bad, the day of the vasectomy. The day afterwards is harder. And one of the reasons why is because you're going to develop some swelling. So when we do this vasectomy, there's blood vessels that run on either side of the vas deferens. And to get to the vas deferens, we have to cut through some of those blood vessels. So it causes swelling when they bleed a little bit. One of the things that's painful in all of medicine is acute swelling because it pushes on nerves in any area. So you're going to notice that acute swelling usually the day after the vasectomy. Your body's going to notice it a little bit more. You're going to have this period of time between when the nerve block is done and the day afterwards where that acute swelling is going to develop. And so that can be probably what I think is probably the toughest day, is the day number one after the vasectomy. So just keep that in mind. I want you to know that. The swelling down there can last for weeks. The pain lasts for less time. So a lot of guys are concerned because they'll talk to a buddy and the buddy said, I was swollen for weeks. And the buddy will just tell them that. And then the guy that's about to get the vasectomy will think if he was swollen for weeks, he must have been in pain for weeks. That's usually not the case. Usually that swelling will take a while to get completely better because if you have a little bit of blood vessels that bled, it takes a while for all that kind of clotted off blood to reabsorb in your body. But the discomfort gets better much sooner than that. So you'll have this acute swelling. You'll even feel kind of maybe even like a knot down there for a few weeks. But usually the discomfort, the acute discomfort with the vasectomy is just for a day or two afterwards. So the concept is the pain gets better way before the swelling gets better. This is the one tip that I tell guys. You're going to get home. Your kids aren't going to necessarily know what procedures that you had. Keep that scrotum still, okay? No jumping on, none of the kids jumping on you, no moving around too much. The more that the scrotum moves, the more those nerves are going to get irritated down there, and the more you're going to feel down there, the more uncomfortable that you are. So Your family's got a list of chores for you to do. Say, listen, I can't do them. I got to sit on the couch. I got to keep it still. Keeping it still is one of the keys to not having discomfort after the vasectomy. And I think that it decreases the swelling afterwards for sure. So remember that. Keep it still. This is my pearl for kind of the tip that I'm going to give you at the end to enhance your recovery after a vasectomy. The most important thing in my experience is scrotal support. So a lot of guys and a lot of patients will think that ice is the most important thing after vasectomy, and that helps. There's no doubt that that helps. But what's even more important is putting a lot of pressure on there immediately. Usually I tell my guys, buy a jock strap, bring it with you on the day of the vasectomy, and wear it out. Because that acute swelling, like we talked about, is the uncomfortable part. And when that acute swelling happens very quickly, then it can be uncomfortable quickly. The scrotum is a place where it's hard to put pressure on the area as manufactured by the body, right? There's not an internal way to put pressure in the scrotum. But if you wear a really tight jock strap, briefs, compression shorts, something like that, it's going to start putting pressure on the area and decrease the chance of you having long-term swelling afterwards. Again, the swelling usually is longer than the pain, but if you have acute swelling, it can cause a lot of discomfort. I usually tell my guys to wear it for 48 to 72 hours after the vasectomy. Some guys have worn it for a week or two and they swear by it. I think that's probably the biggest tip that I can recommend to you for improving your recovery after vasectomy. So that's it. That's kind of what to expect after vasectomy. Most guys do just fine. Hopefully that's helpful to you guys. That's it. Please subscribe to our channel. We'd appreciate it. Have a good day.